So our program differs because we offer a continuum of care. So for example, regardless of where the concussion occurs, we offer services at our urgent care centers and our emergency departments that directly provide patient information to our concussion management programs. So we differ because if you're seen in the ED or the urgent care center, a patient information is immediately transferred to the concussion management program and the patient is seen within 24 hours. And that's important because in the emergency room, a patient may be told not to return to school, not to return to work. And if that's the case, you want to be seen within the next 24 or 48 hours to make plans going forward. When a patient enters the concussion management program, they are first evaluated. And in this evaluation, a parent may be involved, a spouse or a family member, to gather information about the mechanism of injury, the medical history, psychiatric history, academic history, all of the things that affect how a concussion may manifest. Following the initial evaluation, all of our patients undergo coordination examination, balance examination, visual ocular motor, and neurocognitive assessment if it is tolerated. Following an initial evaluation, a patient is provided with treatment recommendations, and these treatment recommendations will vary depending on when the concussion occurred, how severe the concussion is, and what the lifestyle is. So for example, a patient that is a child, school-aged, or an adult, first off, is most likely going to be some period of time where they're going to take a full cognitive or physical rest. There's a window of time that we know is helpful in terms of reducing symptoms with very, very low stimulation. Following that time, the evaluation will determine when it is safe to return to play, or return to school, or return to work. And with that, patients, schools, coaches, guidance counselors, school nurses, our pediatricians, primary care physicians, provided with the treatment plan, the academic accommodations, very specific to each student or adult's concussion. What is so important about this concussion program is that the patient is provided with the earliest intervention. So whether it be that you're at an urgent care center or an emergency room first, or at a pediatrician's office, that you're initially rested and then the rest of the concussion is properly managed. This reduces the amount of time that a concussion may last, and it may also reduce any other further complications related to the concussion.